In un momento in cui la ricerca sull'obesità sta ridefinendo non solo l'approccio terapeutico, ma anche la visione stessa della malattia come condizione cronica sistemica, Novo Nordisk si conferma tra i protagonisti globali dell'innovazione in questo ambito. Noi ne abbiamo parlato con Filip K, Chief Medical Officer di Novo Nordisk. Filip, first of all, could you tell us something about the present and future of Novo Nordisk research in obesity, which are the achievement today in the present, and also what you are developing in your pipeline for the future of obesity research?
Yeah, thank you for that question. So in Novo Nordisk, we have led the innovation in obesity research and medicines for obesity for more than 3 decades now. We were the first to get a really effective obesity medication on the market, and millions of patients are still using semaglutide for the treatment of obesity. And more recently, we really have refocused the company to have an even bigger focus on innovation in new medicines for obesity treatment. So we feel very confident that we have the experience and the innovation capacity to maintain our leadership in obesity worldwide.
You recently obtained the approval of the 7.2 milligram dosage of semaglutide, which is the role of this new product.
Yeah, first, I would like to take one step back and just underline the importance it is to realize that people living with obesity, they have very, very different needs, and they have a range of issues for them to solve. That ranges from losing weight to better manage everyday activities like shopping, climbing the stairs, playing with your children or grandchildren. But it also relates to treating serious complications of obesity, such as, acute hospitalizations, major adverse cardiovascular diseases, but also the risk of premature death. And often all of these issues that people are struggling with, they have, people with obesity have tried to tackle those for sometimes decades or even lifelong. We simply now give doctors and patients more possibilities, more strings on their bow to use, so we actually can tailor the treatment for the individual patient the better. So I see this as a big opportunity for both patients, of course, but certainly also doctors in terms of individualizing treatment.
And looking at the future in obesity research, what's Novo Nordisk doing right now?
Oh, I wish we had the whole day to discuss this, but let me give you some highlights of our late-stage pipeline in obesity. It seems like there is a big unmet need in terms of oral obesity medications, and we will continue to innovate in that space. We will also very much focus on combining biologies, so we not only focus on GLP-1, we are also focusing on another hormone called amylin that originates from the pancreatic beta cells and it's secreted together with insulin. But now we have fine-tuned that molecule into some medicines that seems to have potent effect on body weight that are complementary to the effects of GLP-1. So by combining those two biologies, we see a big potential. We are also playing around with a range of different biologies, including the other incretin hormone, GIP, but also the pancreatic hormone, glucagon. So we are trying to combine those biologies to address this broad unmet need in obesity. And just before I wrap up, I want to say, that we're also focusing on a range of different complications within obesity. So we're trying to design the combination of the individual biologies to fit the individual complications in obesity to kind of tailor the treatment for the individual patients. That's the highlight of our innovation pipeline, I can say.
Not a one size fits all, but a full range of proposal. The expert emphasized that the value of anti-obesity medication goes far beyond weight loss. You mentioned the cardiovascular impact of this disease. What does this mean in general, and what does this mean for you, for Novo Nordisk research?
I mean, I used to be working as a clinician scientist and endocrinologist by training, and I've seen hundreds or thousands of patients suffering from metabolic diseases, including obesity, type 2 diabetes, and so on. And I can tell you, you know, their biggest problem is not the numbers on the scale. Of course, there is a big interest in losing weight, but the reason for that is that it simply improves their quality of life. It reduces the risk of complications, and it prolongs the life in terms of healthy lifespan. That is the focus of the patients. That is the reason why they go to the doctor and ask for obesity medications.
And you are studying this, the impact of your drugs, not only for weight loss, but for cardiovascular diseases, for renal, and so on?
Yes, we have in Novo Nordisk, we have a track record in conducting studies with a focus on the complications for both obesity, but also type 2 diabetes and other forms of metabolic diseases. And we have provided some, but some quite fantastic data, especially in the field of complications to type 2 diabetes, showing that semaglutide reduces the risk of both major adverse cardiovascular events, the risk of cardiovascular-related death. It improves the life of people living with severe kidney diseases. It also helps on obesity-associated liver diseases and a range of other complications. So I think that continues to be a very, very strong focus of us from us, you know, to improve the lives of people living with the metabolic diseases, including obesity and type 2 diabetes. That is our main raison d'etre, you can say.
Very good. Thank you, Filip. There will be many more things to tell about this topic, but the time is very short, and you gave us a very focused message. And thank you very much for what you are doing for your research for millions of people living with obesity around the world. Thank you very much.
Thank you. My pleasure.